Hello, everyone. Thank you all so much for joining. The time now is 3:59 p.m. on Wednesday, May 14th. Thank you all so much for joining. My name is Asia Simpson. I am your wellness and benefits consultant. And we are going to be presenting to you today Medicare 101, as the flyer indicated. We have Kaiser Permanente here who will be presenting, which is, we have Carmen Conover. You've probably seen her before. We also have your benefits department, Laura Simmons here. If you are logged in here, just a couple of quick housekeeping things. Please make sure you keep yourself on mute for the duration of the presentation until we open it up for questions. That will just avoid any unnecessary sound inhibiting everyone else from being able to hear today's presentation. Also, this presentation will be recorded, so please keep that in mind. If you have to fall off for whatever reason early, or you just like to replay this, this will be available for replay. I will be forwarding this over to benefits, and it's typically posted on the benefits website. So I'm going to go ahead and mute you just because we can hear background noise. Um, just once again, please keep yourself on mute until we get to the question and answer portion of today's session. I think I may have covered all of the housekeeping items. I am going to, before we get into the content today, I'm going to share a few introductory slides just to make sure we address some questions that typically come up during the session. And I want to make sure I address them because so the information I'm going to be covering in the first few slides aren't really pertinent to what Carmen will be presenting. So just want to make sure you guys have this information before we jump into all of the wonderful content of Medicare 101. All right, I'm going to start off with sharing my screen here so that you all can see. And I'm going to make this big. If I can get a thumbs up, if you can see my screen. Perfect. Thank you so much. All right. So I've kind of done a little bit of the introductions. So we'll move right into the second bullet that is on here, which is with regards to sensitive information. So I know that a lot of times during this session, you have specific questions regarding your scenario that you want to ask. I would encourage you to not give details about your scenario when you're posing your question, just because this is a recorded session and it is a public session. So you want to make sure that you aren't sharing your protected health information in a forum where everyone is able to hear that information. Now, that doesn't mean that your questions can't be answered. So if you do have questions, we can always speak offline. We can make an appointment if you think it's something that's extensive. In fact, I prefer to speak with you one-on-one. That way you get undivided attention. So I have posted on here my telephone number and my email address. That way we can talk uninterrupted and I can provide you one-on-one support. General questions, please feel free. This will be a time where you can do that. Because we have so many people on today's session, we're going to go through the content first, and then at the end, we'll answer the questions, okay? So I want to do a quick special note. I know that many of you on here may be teachers. I want to note that the Montebello Teachers Association Trust is managed by MTA, and so I know you all may have some questions around what's going on with the trust. All questions regarding the trust, they need to be directed to the MTA office. The district office is not able, the district office or benefits department is not able to assist with those questions related to the trust. So you can contact MTA at the telephone number that's listed here. There's an email address listed here. And as I understand it, there is a session, a virtual session that will be presented at 5 p.m. today. So just so you know that we won't be answering any questions about the trust because I don't have any information that I can provide to you guys. This will be strictly about Medicare 101. So now that that's handled, I want to mention something that I think is important. And this is with regards to the MUSD retiree medical benefit contribution or reimbursement policy, as it really should be termed. I want to mention this because as we start talking about Medicare 101, it's inevitable you will be asking questions about the retirement retirement benefit policy that the district has. And so I want to clarify a few pieces of information that might make it helpful for you to keep in mind when we are talking about Medicare 101, and so you don't get these things, these age benchmarks confused, okay? So the first thing I want to say is that in order for you to qualify as a regular retiree eligible for district reimbursements, you have to have at least 15 years of district service and you have to be at least 55 years of age. Those are two requirements, okay? With this, with those meeting those requirements, what will happen when you retire is the district will reimburse medical insurance premiums until the end of the month up to the age of 67. I'm going to talk about why that's important here in just 2 seconds. The maximum amount the district will reimburse changes each year, and that is always announced and posted on the benefits page in the retiree letter. That amount changes each year because the district determines what amounts might potentially need to be increased to kind of help meet the changing needs in the healthcare premium environment. Okay, so that's why that changes each year, but it is posted each year on the benefits page. And then after you hit the age of 67, that is when your district contributions stop. Okay. The district will stop reimbursing at the age of 67. Now, if you are a teacher and you've been contributing to the trust, then you will want to contact MTA to find out information about trust information and how your reimbursements will go beyond the age of 67. This is important because you need to know what your out-of-pocket costs will be. Now, what I don't want you to get confused about is because you're going to hear 65 in today's presentation, and you're going to hear, you've heard 67, and you'll probably hear the age 67 later as well. But I have this up because I want you to distinguish the difference in the two important age benchmarks. The first one applies mainly to today's session. We're talking about Medicare, Medicare 101, and that's the age of 65. The age of 65, you must apply for Medicare. And the medical plans that will take care of you with your health coverage are going to change at the age of 65. That's why that's important, okay? But as it pertains to the district and your benefits with the district, the age 67 is important because that is the point at which they stop doing reimbursements. So keep those two age benchmarks separate in your head. And for the purposes of today's session, 65 is what we're going to be focusing on because when you hit 65, that's when Medicare becomes relevant. Okay. Now, with that segue, I'm actually going to turn it over to Carmen Conover so that she can actually go ahead and share with us the content on the Medicare 101 session. And Carmen, I
All
will go
right.
over to you.
Thank you, Asia.
No problem.
Okay, what screen are you seeing, Asia?
Just the note screen. So just
Okay, I need
one
to change it.
more.
Yeah.
All
Same
right.
thing?
Nope, we got
Is,
we're good. We're good.
okay. Okay, and I'm going to turn off my video here just to save some bandwidth. All right. Hi, everyone. Thank you for joining us. Again, as Asia mentioned, my name is Carmen Conover. I am with Kaiser Permanente, and I am going to go over Medicare 101 for retirees with CalPERS health benefits. Even though I am with Kaiser, most of what I'm going to cover is um, relevant to everybody, not just Kaiser Permanente members. I have a couple of slides at the end that touch on the two different Kaiser retiree plans. Alrighty, so who can join Medicare? So you are eligible for Medicare if you are 65 or older, you live with a disability, you have end-stage renal disease, or ALS, which is better known as Lou Gehrig's disease. So when I say you're under 65 but live with a disability, if you have, if you are on disability for 2 years, you can then join Medicare. So even if you're 50 years old, if you have been disabled for 2 years, you can enroll in Medicare. All right, what is Medicare? Medicare is a federally funded health insurance program. It was established in 1965, and it's administered by the Centers for Medicare and Medicaid Services. You'll hear that referred to as CMS, and you'll probably hear that, especially in the news, quite a bit. CMS administers Medicare and Medicaid. Medicare includes four parts. Even though sometimes you hear Medicare Part A, B, C, D, E, F, there's all these letters. The ones that you really want to pay attention to are A, B, C, and D. Those are the really important ones. So Part A is your hospital insurance. Part B is your medical insurance. So those two together are known as Original Medicare. You also have Part D, as in dog, which is your prescription drug coverage. And you'll hear us refer to Medicare Part C. So Medicare Part C is basically an Advantage plan, which means it's Medicare Part A, B, and D all together. All right,
So
so
Carmen,
yes.
a quick point of clarification so people aren't completely confused. So when you hear Medicare Advantage, they're really just talking about A, B, and D all together instead of saying Part A, Part B, Part
Right.
D.
Right. So
And
Medicare
then
Advantage or Medicare C, because C is all of those put together. So it could
all
get a
those
little
put together.
confusing. Yep,
Yes.
yep,
Just so people aren't confused. So it's just an easier way of Part C is just an easier way of saying Part A, Part B, and D.
yep, yep.
Just
All righty. So let's talk about Part A, hospital insurance. So Part A is hospital insurance, and it covers you for inpatient hospital care, skilled nursing facility, hospice, and home health. If you have worked at least 10 years or 40 quarters and you paid into Medicare, there is no cost for your Part A. If you did not pay into Medicare, you may be eligible for premium-free Part A through your spouse. So if your spouse has worked for 10 years, you can tap into their um, Medicare. Okay, what is Part B? So Part B is medical insurance that covers your doctors and other healthcare providers services like lab, radiology, um, durable medical equipment, dialysis, some preventive services, and we'll go over that in the next slide. Now, your monthly Part B premium is usually deducted from your Social Security check. And sometimes people get a little confused with that Part B premium. That Part B premium does not go to Kaiser. It does not go to CalPERS. It does not go to Montebello USD. That Part B premium goes to the federal government. In the next slide, we'll look into that a little bit. You may be subject to a late enrollment penalty of 10% for every 12-month period you decline coverage if you do not enroll promptly. So usually people hear that, and when you turn 65, you're going to start getting all these mailers from Kaiser, HealthNet, Aetna, United. They're all going to say enroll in our Medicare plan. You're turning 65. If you continue to work and you have your health insurance through Montebello Unified, or you're a dependent on your spouse's work health insurance, you don't need to worry about that. This penalty is for those who, let's say you retire and you decide, well, I'm pretty healthy. I don't need health insurance, so I'm not going to enroll in it. I'm not going to enroll in Medicare. I'm not going to buy any health insurance. And 2 years later, you find out you have diabetes, you have cancer. Now you need health insurance. When you go to Social Security and you say, now I want to enroll in Medicare, they're going to say you were eligible 2 years ago. You didn't enroll in Medicare, you didn't have health insurance. Now you are going to have a 10% penalty for each 12-month period that you didn't have coverage. And that's not just a one-time shot, that's for the rest of your life. So you want to keep on top of that. Sometimes people say, I don't want to worry about it, so I'm 65, but I'm going to continue working, so I'm going to enroll in Part B. There's a cost involved, and you really don't need to do that. And I'll share a little bit of that in the next slide. Again, you do not have that late enrollment penalty if you have health coverage through your employer or through your spouse's employer. Already. This is the cost of Medicare Part B. Remember, we mentioned if you're eligible for Part A, that's the one where if you're 65, CalPERS encourages you to enroll in Part A. For most people, there is no cost involved. There is a cost involved in Part B, and these are the costs. For most people, it's going to be $185. That's if you make 106,000 or less, or if you're a married couple, 212,000 or less. And that 185, that is per individual. If you are a higher income earner, um, the amount that you pay goes up. And keep in mind that this is a 2-year look back period. So if you retire now, they're going to look at your tax return from 2023. And your income may be higher, it may have been lower. Um, and usually people say, why, if I retire, my income is going to go down. Why are you looking at my tax return from 2 years ago? In 2 years, the amount that you pay for your Part B may go down. But if you feel that it's unreasonably high, you can contact Social Security and, tell them, hey, I'm now making $80,000 a year. Um, can we work something out and see what they say? Um, Alrighty, so let's go on to the next slide. All right, Part A and B. So let's see. All right, so your initial enrollment period, when are you first eligible to enroll in Medicare? You can enroll up to 3 months before the month of your birthday, the month of your birthday, and 3 months after your birthday. So your initial enrollment period is actually going to be 7 months. Um, and again, if you are working past the age of 65, you can enroll in Part A 3 months before your 65th birthday. If you are already retired, and let's say you retire before 65, then 3 months before your 65th birthday, you make sure you enroll in Part A and Part B because you need to have both Part A and Part B in order to enroll in a CalPERS Medicare plan. Alrighty. And again, if you continue working, do you have health insurance through your employer? You can defer that Part B. All right, late enrollment into Medicare. So this is for those people who are working past the age of 65. I know sometimes CalPERS will reach out to a member and say, hey, you're turning 65. What are you doing? Are you retired? Are you still going to work? If you are going to continue working, you want to fill out that CMS 40B. And this is, again, after you retired and you turn 65, you're going to enroll in that CMS 40B. And they're going to ask you, well, you're 67. Why are you enrolling now? And this is when you tell them it's because I just retired. I had health insurance through my employer. Then you're going to fill out CMS L 564. And we'll provide links for this stuff. And that is for your employer to fill out to show that, yes, you had health insurance through your employer up until last month. Okay. This is what those forms look like. Again, these are your CMS Medicare forms. That first one is when you're going to tell Medicare, now I want to enroll in Medicare. I didn't do it when I first turned 65 because I still had health insurance. And that second form is the one, that bottom part is to be filled out by your employer. So it's basically telling Medicare, yes, this person had group health insurance, so they are not subject to that penalty. All right, your Part D prescription drug coverage. So, what is that and what does it cover? Um, so, Part D, as we mentioned, these are your drugs, your outpatient drugs. Um, and unlike Medicare Parts A and B, Part D is not directly offered by Medicare. It's provided through your plan, through your health plan. So, for example, with Kaiser, we include the prescriptions there. I believe United uses Optum. So, you have a drug plan through your insurer. So, CalPERS sponsored plans and Part D enrollment. Um, uh, if you enroll in a CalPERS Medicare Advantage plan, that already has your Part D prescriptions in there. If you enroll in a CalPERS sponsored Medicare supplement plan, then you need to enroll in a Part D prescription drug plan, but don't enroll in a non-CalPERS Part D plan. Sometimes people do this. They're at Walmart or they're at Costco, and somebody has a table set up and it says, Medicare Part D, your prescriptions will be $5 for everything or $3. If you enroll in that, Medicare will cancel your health plan. So make sure you don't enroll in any outside Part D plan because all of your CalPERS medical plans include that Part D.
And I wanted to just mention for non-Kaiser plans, if you enroll in the supplement plan, you will have the Medicare Part D through Optum attached to your plan as well. So just reiterating what Carmen said, don't enroll in anything outside of it. You will be able to get Medicare Part D if you enroll in a plan that is not non-Kaiser. So don't take those flyers, marketing materials, and all of that that you get and enroll. Otherwise, it'll kick you out, just as she
Yep.
mentioned.
Yep. Alrighty. Okay. So so with your Part D, your prescription drug plan coverage, there is also um, a income related monthly adjustment amount, what's called IRMA, but that is only for higher income earners. So if you earn $212,000 or less, then there is no cost. But if you look at this and if you earn between 106,000 and 133,000, then there is that additional $13.70 per member per month. So if it's you and a spouse, you will each pay that additional $13.70. And again, this is a 2-year look back period. So it's if you are subject to this income related monthly adjustment amount, it may change in the coming years. So you want to keep that in mind. All right. The low income subsidy is Medicare's extra help program for beneficiaries with limited income and resources. And that is to help with your Part D premium and your outpatient copays. Um, Now, we talked about those higher income subsidies that some people will have to pay because they're higher income earners. This is the opposite of that. So if you are on the lower income bracket, um, Medicare can provide help with Part D premiums and outpatient drug copays. Um, and the degree of how much it covers, that depends on your income and any resources that you have. And you would apply at Social Security or at your Medicaid office. It's administered by your health plan on behalf of CMS. You must be enrolled in a Part D plan to get help. Um, and so keep in mind, sometimes you may come across a coworker who says, well, my copay for my drugs were $3. Why, why is yours $20? Remember, it might be that they're in this low income subsidy, so keep that in mind. All right, so Part C Medicare Advantage Plan. So again, that combines, as Asia mentioned, it combines all of your health benefits from Parts A, B, and D. With Kaiser, you you receive all your coverage through Kaiser. um, services under a network of providers that you must use for care. That's an Advantage plan. Okay. So this isn't the PPO plans. What it costs, Medicare pays an amount for your coverage each month to your health plan. Some plans have additional monthly premiums. Um, and if you choose an out-of-network provider, you'll be financially responsible, except in the case of emergency or urgent care. So, regardless of which plan you have, remember that you have urgent care and emergency coverage um, anywhere in the world. So even if you have Kaiser and you happen to be in New York and you have a heart attack, you're going to be covered. That's an emergency. If you have another health plan and you happen to be in Europe and you're hit by a car, that is going to be covered. So you're always going to be covered for emergency and urgent care. All right, these are your health plan options. So remember those Medicare Advantage plans, the Part C. These are your options. You have an Anthem PPO plan, and that one's available in California only. You have a Blue Shield Medicare PPO, and that is available nationwide. You have two different Kaiser Senior Advantage HMO plans. The Summit plan is basically a richer plan and it has zero copays. That's really the main difference between those two. Sharp Direct Advantage is available in the San Diego area. And then you also have United Health Group PPO, which is nationwide. For your supplement plans, your PPO plans, you have the Purse Platinum, which is available nationwide. And we sometimes have people who say, I'm going to be traveling. Well, if you're going to be traveling and you have an emergency or urgent care, all of your health plans are going to cover that. But sometimes we get people who say, well, I'm moving to the Philippines. Are there any CalPERS plans that will cover me there? And the only one is going to be your PERS Platinum. That one covers you internationally, so even if you move out of the country. And your PERS Gold supplement PPO plan, that is available throughout California. All right, the Medicare enrollment process. So if you are retiring and you want to maintain your retiree health coverage, um, and you and your family members, eligible family members, so usually that's going to be a spouse or domestic partner. If you are eligible for premium-free Part A, you must contact Social Security to then enroll in Part B. So again, you have to have Medicare Part A and Part B. And you have to start paying that monthly Part B premium. And I do want to mention some people have said that maybe they start receiving Social Security, but they're still working, and Social Security is now deducting that Part B premium. You don't need to pay that until you're actually going to retire. So let Social Security know that you're still working and that you don't want to pay your Part B yet. CalPERS will enroll you in the appropriate default plan based on your eligibility. Medicare all family members have Part A. So these are a couple of options. So if you and your spouse have Medicare Part A and B and you are retiring, both you and your spouse must enroll in Medicare Part A and B, and you will each be enrolled in a Medicare plan. The combo plan, and if you look at the CalPERS website and you look at the rates, combo basically means one of you is Medicare eligible, the other is not. So let's say you're retiring, you're 66 years old, your spouse is 60. Well, your 60-year-old spouse cannot enroll in Medicare because they're not 65. So that's a combo plan. That means that you will enroll in a Medicare plan. Your spouse will remain on a basic plan. And then that third one, basic, that means when no family members have Medicare Parts A and B, that means it basically means you're both, you're retired and you are both under the age of 65 and you're not eligible to enroll in Medicare Part A and B yet.
And so
Um,
just a quick point on that, so that just so that you all are clear, if you're under the age of 65 and you are retired, your plan that you are currently in, that will be the same plan that you're in when you retire if you're under 65. Unless you switch from like a Kaiser to Blue Shield or Kaiser to Anthem or anything like that. But your the type of plan that you have right now is what you would be eligible for when you retire, if you retire under the age of 65. Hope that makes sense.
Alrighty. And then if you wish to change health plans, you can contact CalPERS. Um, if CalPERS sends you a certification of Medicare status, and this is what I mentioned earlier, sometimes CalPERS will send this, and they're basically asking you, hey, you're 65, what are you doing? Are you working? Are you going to retire? And you just fill out that form and send it back to CalPERS. You can change plans during open enrollment, just like active employees. So if you're retired and you're on a Medicare plan through CalPERS, at open enrollment, you can switch plans. Or if you have a triggering event, like you're moving, some health plans, Kaiser in particular, if you move from one area, let's say you're living in Montebello, but then you decide to move to Adelanto. Well, Adelanto's not in the Kaiser area, so you have to switch it, pick a different plan. Or you're moving from California to Nevada. You may select a different plan because you're moving. All right, this is the Medicare enrollment plan. The one on the left is a certification of Medicare status. Now, the earlier forms I showed were from CMS. These are from CalPERS. This one is on the left is CalPERS asking you, are you going to continue working? Um, are you retired? Are you enrolled in Medicare? And there's a space there in the center. If you see that, you can put your Medicare Part A. Let's say you're 67, you enrolled in Medicare Part A. Again, that's no cost. You can put that information there. If you're still working, you don't need to put that Part B effective date. But there on the bottom, you can indicate that you have deferred enrollment in Part B because you're still working. The form on the right is what you use to make changes to your health coverage. Okay. And this is the CalPERS website. Most of you are probably used to going under um, the health and Medicare, and you basically look under the
Yeah.
basic plans. There is
No,
an
they
area.
don't look at it.
Oh, they don't.
I don't think most look at it. They
Okay.
have they look at a lot of people look at their rate sheet on the
Yeah, that's the important thing.
some of you might let me not
Yeah.
say that.
And if you plan on moving, let's say you plan on moving to Texas, and you want to see what plans are available there, on this webpage, there's a link there. It says health plan search by zip code. You can actually type in a zip code and it tells you which plans you can enroll in. And then those links on the bottom, the very bottom there, CalPERS 2025 in-state and out-of-state premiums. If you click on that, it'll show you what the premiums are. So even though you may not be familiar with this page, it wouldn't hurt to take a look at that, especially if you plan on moving or if you want to switch health plans. Alrighty, so Kaiser Permanente Medicare health plan. So again, Kaiser Permanente is an Advantage plan. It includes your Part D, and as a Kaiser Permanente member, you get your Medicare benefits through Kaiser. If you are a current Kaiser member and you are on the basic plan and you're 65 and you're still working, of course, nothing's going to change. But let's say you're now going to retire. Um, Now you're going to enroll in Medicare Part A and B. Now you're going to enroll in Kaiser Senior Advantage. Nothing is going to change for the most part. Your Kaiser number will stay the same. Your primary doctor stays the same. If you use kp.org, the website, that will remain the same. The only thing that might change is your Kaiser card might say Medicare Advantage, um, and maybe your copays might change a little bit. Otherwise, everything will remain the same. These are areas where you have Kaiser. Kaiser is not in every state. And I mentioned that zip code search on the CalPERS website because sometimes we have Kaiser members who say, well, I want to move to Nevada. Well, you're going to have to pick a different health plan because there is no Kaiser in Nevada. These are the regions in the United States where you have Kaiser. And people often ask, what's the difference between Senior Advantage and Summit? There's not a whole lot of difference. If you look on the right column, the main difference is that your copay for the doctor is zero. Um, Otherwise, everything else is the same. Um, so with your Kaiser Senior Advantage plans, you have a couple of added benefits. You have chiropractic and acupuncture pretty much with all of your health plans. You have a vision benefit. You have a one pass gym membership, and you have transportation to medical appointments up to 50 miles one way. And you get discounted. You get a certain dollar amount to use toward over-the-counter medications. You have meal delivery if you've been hospitalized. You can have meals delivered to your home at no cost. And these are some phone numbers you want to keep handy and some websites. So that first one there is Kaiser Member Services, but you also have Social Security. You have the Medicare contact information there, and you have the CalPERS contact information there. And these are good numbers and websites to keep handy. Um, and that is all I have. Thank you.
So, thank you so much, Carmen.
You're welcome.
So before I open up for questions, there are a few clarifying points that I would like to make for you all, just to make sure that there's no confusion. So first things first, just based off of a couple of questions that I got through the chat box while Carmen was presenting, I wanted to encourage you all, if you have an opportunity, to log into the your Social Security Administration portal. This presentation will be made available for you to download, and the link for Social Security is on there. And we will actually have the presentation so you can actually look at the numbers on the actual slides. So you'll have the telephone numbers, the not only the recording, but all of the slides and everything will be available in there. But when you go in there, I would suggest that you log into, if you've never done it before, log into the Social Security Administration portal. And it's important for you to do that so that you can see if your income that's being reported is looking correct. Because if you recall in the beginning of the presentation, one of the things that Carmen mentioned is that in order to be eligible for Medicare, you have to have worked enough time in order to be eligible for that. And if you can't figure out for whatever reason why Social Security or Medicare or CMS may be saying that you're not eligible for Medicare, you may want to check your portal and make sure that your income history is being properly reported. So that's something that I would highly suggest you do. Here are the telephone numbers, but as I mentioned before, this will be, if you can't jot it down fast enough, this information will be posted on the benefits page. And if you've ever been to the benefits page, you know that once it's posted on there, it's on there again until we do it again. All right. The other thing that I wanted to mention to you all is something important. You know, right around the time that you guys get ready to turn 65, you are going to be bombarded with lots and lots of mail. I mean, you're going to be hit with things from a health plan, your what you believe to be your health plan, if you're on Kaiser or Blue Shield or Anthem or United Healthcare, whatever the case it might be. You may get lots of mailers from what you think is your health plan. I would again encourage you not to enroll in anything that you receive from any of those mailers. Unless you receive something from your health plan that has your medical record number or your insurance number, member ID number on there, I would not respond to it at all because there are other health insurance carriers that are standalone, separate from CalPERS, the plans that are offered through CalPERS, that are really just trying to get you to enroll. And it can be very overwhelming. What I will say to you as rule of thumb, some things to always make sure you look at. Some things that you make sure you don't throw in the trash is going to be any information you get from Social Security or the Center for Medicaid, Medicare, and Medicaid Services. Anything you get directly from CalPERS is also going to be very, very important for you to make sure that you hang on to. And like I mentioned, if you do get something from your health plan that has your actual medical record number, your actual insurance ID on there, you want to keep that. Those are the things you want to make sure you keep. The other thing I want to warn you of, because it has become an overwhelmingly horrible problem, is the number of people who will try to call and spam you or take your identity right around the open enrollment period, or even if they, for whatever reason, catch wind of the fact that you are approaching 65. And how can they do that, you ask? There are breaches all over the place. Many organizations end up having breaches, hospitals, you can just watch in the news and you'll see that. But I say all that to make sure that you are on guard about anyone calling and asking for your information and offering you enrollment in Medicare. I would not provide them any information over the phone. Do not share your information. Do not, do not, do not do that. Okay. For your own safety. One thing I wanted to mention that I thought was extremely helpful for those of you who will be retiring, and you may not be retiring in the state of California, please make sure you take a look at the CalPERS website that Carmen presented and use that search engine so that you can search for any plans that you might be able to enroll in and have access to out of state. Please know that not all of the CalPERS Medicare plans are plans that you can enroll in and take advantage of outside the state of California. So there are some that are just limited to the state of California. So keep that in mind. And with that being said, those are the main things I wanted to remind you all.